Welcome to the Holistic Feline and Friends podcast, home for all things holistic and healthful for our pets. I'm your host, Angela, also known as the Holistic Feline on Instagram. In this episode, we are talking to renowned Integrative-Holistic Veterinarian, the one and only Dr. Margo Roman. She has been practicing for over 30 years and is a legend and true pioneer in bringing ozone therapy and microbiome restorative therapy, also known as fecal transplants, into the world of vet med. We will learn the power of fecal transplants and how it can transform your pet's health and behavior, helping them recover from skin allergies, diarrhea, IBS, pancreatitis, kidney and liver failure, ear infections, cancer, autoimmune disease, even behavior, and so much more. We'll also learn the power of ozone therapy and how combining it with microbiome restorative therapy can lead to magical outcomes for our pet's health. If you've been told there are no other solutions and conventional treatments you've been trying aren't working, please listen to this episode first. Dr. Margo lives, breathes, and is real solutions. My hope is you will find healing within this episode so you and your pet can get onto the road of recovery and healthful living side by side. Please enjoy Dr. Margo Roman. Welcome, Dr. Margo Roman. I'm so excited to have you. I've been following you for years and I cannot wait to dive in with you. Let's start with introducing yourself. Can you let everyone know who you are and what you do?
My name is Margo Roman. I have been out of vet school since 1978. I graduated Tuskegee in Alabama. At that time, I had already taken the acupuncture course and was the first woman to take the veterinary acupuncture course in the United States. So that was my claim to fame, is, being able to do acupuncture back in 1975. So I went to vet school with the thought that integrative medicine is a possibility throughout your education. From that, I did an internship at Angel and was at Animal Medical Center prior to that. But I opened up my veterinary clinic in 1982 as a holistic veterinary practice. Later, after like 10 years, I started to do almost all integrative and holistic. So my clinic is called MASH in Hopkinton, and very proud that we have been the leader in doing integrative medicine. And by having these other choices and options in my decisions to help my cats and dogs, I was able to find better solutions that I think to the standard of care, which obviously is lots of antibiotics, lots of biopsies, lots of different medications to try to solve problems, and where we could try to do the best to regenerate the gut flora and strengthen the gut itself was my goal when it came to irritable bowel.
The irritable bowel syndrome is near and dear, and I have a personal experience with that. Can you define what irritable bowel syndrome is?
Well, people would clump it into irritable bowel syndrome in that the gut is just not properly digesting and processing food. So animals may not have good absorption and it runs through them and they're constantly having diarrhea. Some irritable bowel are constipation. So what it is, it's an imbalance of the gut. And to know the exact reason why suddenly someone gets this is still in debate. Do they go on a medication that kills the GI tract and causes severe dysbiosis? They're able to identify, Clostridium difficile in humans as a dysbiosis of the gut. And that has been, claimed Clostridium difficile issues. And animals probably have a very similar thing, but it may not be just Clostridium difficile. It may be 4 different species that they're missing. And with a weakened immune system and the constant bombarding that we feed our animals with food that is tainted with glyphosate, which is Roundup from genetically modified foods that are fed to the animals they are consuming, as well as in the food itself, we cannot balance out that gut because glyphosate, which has a patent as an antibiotic for the intestinal tract, is constantly depopulating your gut when you eat it. So these animals that are very small and they're getting small amounts of these foods, it's enough probably to disrupt their gut flora, and therefore they may try to get in balance and all of a sudden someone kicks it down the road and they fall back out again. Could it be due to an autoimmune problem? Since 80% of your immune system comes from your gut, if your gut is imbalanced, it could be an autoimmune disease because your gut is 80% of your immune system. And so these animals that have this chronic diarrhea, we need to go through some testing and verification of what it could be. It doesn't always mean putting them under general anesthesia and doing extensive biopsies and ultrasounds and everything else. It used to be if they've had irritable bowel, they're going to get lymphoma of the intestinal tract. That was sort of the go-to back 25, 30 years ago. If the cats have this chronic diarrhea, they're going to end up with lymphoma of the intestinal tract. And that was sort of the kind of, if they're going to end up with lymphoma. You know, they probably have lymphoma, but it's not there yet.
Wow. Can I just say that you just blew my mind? Because when I say that I had a personal experience, it was that exact thing. My little one, she passed in 2017, monkey bean, to small cell intestinal lymphoma. And nobody really connected the dots for me. So after she had passed, I went back and I looked at all of her records, all of her x-rays, all of her tests, and connected the dots between that and my experience that I had with her. Starting around 2 to 3 years of age, she was chronically vomiting. And the vomit kind of just continued throughout her life. And towards the end of her life, it was like projectile vomit, and it was yellow and green and very large amounts of it. And when I sat down and really in retrospect about her life and connected the dots, I came to the conclusion that she had undiagnosed inflammation in the intestinal tract, which turned into chronic inflammation, which then turned into IBS, undiagnosed. And that eventually led to full bloom intestinal lymphoma. And she was 13 when she passed.
Well, I'll tell you, that's a very standard case. So if you see that from the beginning when they're young, and you don't correct the GI tract, and you keep giving them medications to stop the vomiting, you're only suppressing the problem. You're not addressing the problem. And that's part of what conventional medicine does is they don't want to see the cat vomit. So they're going to suppress the vomiting instead of trying to understand why the immune system is reacting that way. And, for years, I went to lectures and I went to some of the top lectures, and mentioned this, and they just sort of laughed at me, so it was hard to speak up and get laughed at. And I felt that way from the very beginning, that you can't just keep suppressing something that is causing a problem. And you got, they'll say, well, you got another 11 years out of the cat by us suppressing it. But maybe you didn't have to make the cat suffer for 11 years constantly vomiting if we could have tried to correct the problem. And that chronic inflammation has to have a toll on the body. And finally, it just sort of gives up and says, I got cancer. I can't fight this anymore. And it's all through my whole intestinal tract. So that's how I would look at it as a holistic veterinarian, is that when the cat started vomiting at 2 years of age, I would have addressed it by, let's increase the microbiome, let's do diversity, let's do ozone, let's try different nutritional things, let's test the cat for this Plechner syndrome, which has been poo-pooed for so long, and it's an immune endocrine imbalance, very common in all the IBS cases that I've seen. I've screened for Plechner syndrome, and they've all had it. So whether it's not talked about because people thought that Plechner was a quack, he has died about 9 or 10 years ago now. And I didn't believe him either, but I had cats and dogs that I tried doing all of my holistic stuff with and got to a point where they were better. But once I tested them and screened them for Plechner and understood that, they got better. But once we started the microbiome restorative therapy and the fecal transplants, everything changed. By adding the fecal, we were opening up the diversity of that gut flora so it could protect the animal.
Well, I will say it's validating to hear from you amongst your experience that IBS does indeed lead to intestinal lymphoma.
Oh, yeah. That's been our standard from the top people, that you're going to end up probably with lymphoma.
Because I know for myself, when she was vomiting, I would call the vet, and she did mention what kind of food is she on. Maybe she's allergic to a protein. So she was on dry food. So I would switch out the protein, but it continued. She was on dry food her whole life up until the last few months of her life is when I started the raw food and some canned food here and there. But she was still primarily on the dry food.
And the dry food is not a normal thing for animals to eat.
Right.
It's heated to very hot temperatures, which that itself can cause cancer. But there's so many, if you start studying functional nutrition and understanding how the body absorbs food, when you have these commercial foods, and cats love it. They put all these flavor enhancers but it's not healthy for them. I don't want to feed him something that's not what his body can absorb properly. I mean, my cats, they eat a raw diet and they eat fresh food and stuff like that.
So for those who aren't necessarily familiar with the signs and symptoms of irritable bowel syndrome, can you kind of describe what to look out for in that?
Okay, sure. Some cats will present with just vomiting all the time. They eat a meal and they vomit. And if it's not a hairball, which is very common if a cat's eating a hairball, then, it could be that they get nauseous and they digest. Some of them will have diarrhea. Some of them will be constipated. Some of them just sort of, you can see they're really uncomfortable. Their expression on their face is like they don't feel good. And so can you describe that kind of feeling in every case? No, but you sort of know that they don't feel good. Doing diagnostics with fecal exams, making sure they don't have some kind of a parasite. And now we have the ability to do extensive DNA analysis through several labs. Animal Biome does a 16S for a dysbiosis, as does VDI and my dog. They do a GI series. Your regular fecal exam is just looking for parasites and some possible bacteria. So this area of medicine is just touching the surface. If there are 4,000 species and we can probably know 100 of them, we know very little about what we're doing, but it's a learning process right now. It used to be that if they didn't have parasites in their gut and they checked for like 6 things, their guts were fine. Well, that's sort of really stupid because there's so much more than 6 parasites in the gut. So, when you do a fecal float and they say, well, your dog's fine or your cat's fine, it doesn't have any parasites, that doesn't really tell you very much because they're missing out on 3,996 things. So, but it's because it's so vast, we may never know the answer in our lifetime, but to treat it and respect it and know that it's been taking care of these animals for hundreds of thousands of years is what we have to do, millions of years. So the symptoms can be from vomiting all the time to, emaciation because they can't digest anything are some of the ways that, extreme cases of IBD or IBS is there.
And is IBS reversible and or preventable?
Oh, that's a good question. Is it preventable? I would hope so. So let's go back to the microbiome and the origins of microbiome. If a kitten is born, it goes through the vaginal canal and it usually comes out in a sac. And the mother breaks the sac open. She's licking her vulva. She's licking the kitten. Same thing with the dogs. And she's licking their mouths, cleaning their mouths. She is transferring what we call the vaginal gulp. So she is giving the vaginal materials and the microbes to that little kitten, or that puppy is getting it from the dog. And that's the original inoculation from that mother to the baby. As that kitten nurses and crawls around on the space where it lives, its mouth is getting things into it, and it starts eating, and it starts getting a whole diverse microbial population that will help navigate its future. If that kitten is dewormed and given antibiotics, it's sabotaged. It's sabotaged from the time it starts getting that. But that is the standard of care. If a kitten gets diarrhea, it's put on antibiotics, which makes them more dysbiotic, right? So getting them a healthy microbiome from a cat who's never had antibiotics for generations or for years and has had solid GI tract is what I would try to get into that kitten as soon as possible. So we do this a lot with puppies, not so much with kittens, because again, we don't have as much microbial cat poop, but I give all new puppies in my clinic that come in a fecal transplant orally by oral capsules.
So you mentioned fecal transplants as being a modality to treat IBS, and it's also known as microbiome restorative therapy. And so can you just explain to the listeners what that is and how it helps and how it's administered?
Okay, so the term FMT, which is fecal microbiota transplantation, is the standard way we describe fecal transplants, okay? And that term was created in 2010 by 3 gastroenterologists drinking beer one day and said, let's call it this. And to me, I'm doing more than just giving them poop, okay? What we do, and I coined the word microbiome restorative therapy because I'm restoring the gut. I'm not just giving them poop. So we're giving them types of nutraceuticals and nutrition that prepares the terrain to accept the new microbes and allows it to mesh together. To be successful, to get everything to mesh together, often there's a biofilm that's present in the gut. And a biofilm is that slime that's in your mouth when you wake up in the morning. It's an overgrowth of bacteria that is normal to you, but would block other bacteria from coming in. And if you're perfectly in balance and nothing is wrong with you, your biofilm may be okay, but most animals it's not okay. So in order to get the microbial population to mix in and start to populate an area, the biofilm needs to be removed. So if you just do FMT, or fecal microbiota transplantation, and don't do all the other supportive things that I've put together as the term microbiome restorative therapy, you're not getting the full picture and you may not get the best results. You'll get results, but I want to see us sort of seal the deal and get everything to be running as smooth as possible without falling down. And I think the term FMT, when you just put poop into it and you don't do all the support, it's okay if the animal just has a little bit of dysbiosis, but if the animal has a chronic irritation in there, it may need a lot more than just giving them stool.
To break it down in the most simplest terms, a fecal transplant itself can be performed orally or rectally, and it involves taking healthy microbiome poop from a dog or cat and transplanting it into the unhealthy microbiome of a dog or cat. Can you walk us through each of those methods?
So I do a rectal fecal transplant. Prior to it, I use medical ozone to disrupt the biofilm. We give them ozone gas. We try to get them to defecate. And cats in the clinic, it's not so easy to get them to defecate. So we shut the lights out. We put the cat litter down. I tell the owner even to bring their own cat litter box. And we let them remove as much as they can because they can't hold that much. So we try to put the gas into an empty colon. But if it's not empty, giving them a syringe of gas. So a cat that's like 12 pounds would probably get like 20 cc's of ozone gas. So it's like a big fart, So we put the catheter in, put it deeper than you would a thermometer. We try to put it up, maybe 6 to 8 inches up there, give them the gas, hold their little tail down, wait a little bit, have the litter box there. And most of the time they'll defecate stuff that's down in the colon, but sometimes they don't. And we have to sometimes do it again. Because when I give the fecal, if I give it to them, because cats, if they're in the car, they may get upset and defecate it out, and then it's wasted. It's not wasted, but it's not going to work as well because it didn't have a chance to mesh in there. So we give the fecal transplant rectally, and I usually have the cat stay there. We massage it. We try to massage the fecal material so it goes all through the transverse colon and stuff like that. And then we tell the owner to confine the cat in the carrier. Do not let it poop until the next morning if possible, which is in some cats, they can do that. They stay in the carrier. They don't eat very much in the carrier to give them a little treat so they don't have to go to the bathroom. And if you do let them go because they look like they have to pee, just let them go in real quickly and put them back in the carrier. Sometimes we'll start them on the oral capsules 1 or 2 days before, but we often can start them at the same time. And then we put them on the capsules for about 2 weeks with the nutraceuticals that we use to feed the microbial population with colostrum, feed the gut with gut ion and standard process enteric support. And then I use a product by RX Vitamins called Nutrigest, which has some probiotic, but mostly it's fructosaccharides and different herbs that help modulate the gut. And so it's just sort of empowering that. But again, if I know the cat has this Plechter syndrome, then I want to add more than that. So that's why if the veterinarian they're going to has a little background in alternative medicine, I'm happy to do a consult with them and give them the nuances of doing it successfully. Because after doing it for now 13 years, I've sort of figured out ways to make it more effective.
And do you think that fecal transplants can reverse IBS?
Yes.
Wonderful.
Yeah. So, obviously if there's cancer already started, you're going to need to be a lot more aggressive than a fecal transplant. So doing a fecal transplant is how I do all my cancer cases now. If I can establish 80% of a healthy immune system in an animal that has cancer, what should be the first thing I do? Give them chemo? No. Get their immune system to stand up for itself. And I don't expect to cure cancer, but if I can give them higher quality of life with a better microbiome that's feeding their immune system and supporting them, that should be the first thing people do, not, oh, well, everything else doesn't work. Let's try the fecal transplant.
So from your experience, what else can fecal transplants help with besides IBS?
Oh, everything. It's so amazing. From diarrhea to skin allergies, to ear infections, to pancreatitis, to kidney failure, to liver failure, to behavior, and to cancer and autoimmune disease. Pretty much covers the gamut of what we treat in animals. So instead of getting off the shelf an antibiotic, that should be the last thing that somebody gets off the shelf, not the first thing people get off the shelf.
And I assume this does occur, but for an animal receiving a fecal transplant, will they adopt some qualities or characteristics of the donor animal?
Yes. So my dogs are very social and very friendly. That's why we use it for behavior. So when we give a fecal transplant from our dogs to dogs that are aggressive, they become sweet. Dogs that are anxious become less anxious. It's so beautiful. It is so cool that the gut-brain connection is real. Let me tell you the story about Tober, because that's a great, great case. So Tober was owned by this woman. She has had irritable bowel for most of her life. And how she described her coming in was that she would have poop 11 times during the day. And she would literally spray it in the litter box. And so she had like 5 litter boxes in the basement, and she would just spray around the whole thing. It was just like liquid, right? She was like a feather. And when you picked her up, the stool would come running down your leg. It just soak your pants. She said the cat would not come up from the basement. When the dog went downstairs, it would hiss and spit at the dog and freak out and have diarrhea all over the place again. Anyway, she'd already spent, I think, like $3,000 or $4,000 at the specialist for a year or so going back, and she was very conservative on spending money, so that was a lot of money for her to spend. And they were going to do exploratory surgery on the cat, and that was going to cost her something like $5,000 to do it. So she had that scheduled for like 2 weeks or whatever to have it done. So I said, well, let's try this first. Let's try the fecal transplant, right? We did the fecal transplant. She calls me in 2 days or 3 days, sends me a picture which looks like 2 little penguins standing on top of an ice thing of the stools. The cat has never had a solid stool ever. These were like 2 normal stools. She couldn't believe it. She took pictures of every single poop. She could not believe that it wasn't spraying liquid all over her thing, right? But that didn't surprise me. I mean, that was what I expected. What surprised me is the cat would never leave the basement. She found the cat 3 days later sleeping next to the dog on the couch. Now that to me was a miracle. So that's Tober's story. And, she has flare-ups periodically and comes in and gets a fecal transplant. She has Plechter, and so she breaks through. So she has breakthroughs, but we get her balance back again, and she's not going to an emergency clinic. So that's why it's important for me to do that testing, because if it happens again, if she goes to a regular clinic, they're going to put it on metronidazole, and they're going to do all the same stuff that they do. And it's not going to make her better. It's just going to stop it for that few days, and then they take it off and starts again. But by doing the fecal transplant and her staying up on the medications, mostly nutraceuticals that I do, then there's success.
And how many rounds of fecal transplants is typical?
Usually I do it I'm thinking of this one little Siamese cat that I took care of. She gets a piece of poop like every 2 weeks, just to be sure, because it maintains her. So she just gives her a capsule every 2 weeks. But she had severe irritable bowel diagnosed, at the large clinics and everything else. And she has Pleckner. So she's being treated for Pleckner, but she's happy and she doesn't have diarrhea and she's not, nasty. She used to be so upset because she didn't feel good. She really was, not feeling good all the time.
And with fecal transplants, when you are treating a particular ailment or behavior issue or whatever it may be, is it a case where it can be like a one time or one round thing and then it heals it and regenerates it?
You hope so. I don't know. Some of the ones I do a fecal transplant, they're fine. Nothing, it's done, sealed and done. And I think it depends on how badly damaged the gut is and how dysbiotic they are. So if my dogs, I don't know how many species my dog has, but if I replace enough that balances it back again, then the dog is in balance again. But if they go and they put flea product on it, and that happened in one of my cases where the dog had irritable bowel for 18 months, had been having diarrhea 5 to 6 times a day and 6 times at night. And the owners couldn't sleep. They had to go out every 2 hours, took the dog out at diarrhea. And they did that for almost a year. And they went to the specialist. They couldn't figure out what was going on with the dog. They couldn't figure it out. Gorgeous red standard poodle. Gorgeous. And he was 6 months old when he came off the plane, was covered with diarrhea. And now he's over a year and a half and he still has diarrhea. And on antibiotics, on everything. All these testing, everything done, and they couldn't figure it out. She came to me. So I said, if I can correct your dog's problem, can I talk about your dog to anyone I want? Can I call the referral hospital and talk to them and let them know what I did? And she said, it would be a miracle. And if you could do it, you can tell everyone your story. And because the main hospital that she went to said, we can't figure it out, maybe you should euthanize the dog because they can't control this diarrhea. And they had tried 2 fecal transplants from their donors, which have nothing to do with health like my donors have. The first one, they got 1 less diarrhea at night. They thought that was an extra 2 hours of sleep. So there was an improvement, right? And then they gave another fecal transplant, and then it came back the same number of times. So we did the fecal transplant. 2 days later, she sends me a picture of the poop in the snow. Perfectly normal stools. Dog never had that ever in its whole life.
So amazing and exciting that we can turn our pets' health around with this modality. So where could listeners obtain fecal transplants for their own pets?
For the dogs, we only sell to veterinarians. Animalbiome does have cat product, and they sell also the dog product. At this point, they don't have our dogs anymore. But the Legacy Biome, which is only using our dogs for their fecal capsules, they have it. It's legacybiome.com and animalbiome.com. And we do have some cat, but it's very limited. We make cat slurries for the fecal transplants, and we do have those for veterinarians. I have 8 dogs, but I have only 2 cats, and they don't make enough poop to supply everybody,
I think you need more cats.
I know. I was just talking about it today, and, my house is animal house, right? My donors, I live on 7 acres of virgin woods that we built our house 42 years ago, green and sustainable. So everything in my house is organic. I don't use any chemicals in my house. I would not have Febreze, or my dogs and cats don't get flea medications. They get natural herbal stuff or, amber collars. I don't have fluoride and chlorine in the water. And now we can just talk about what's in the air and the water. I live on land that has never had fertilizers or Roundup or pesticides, so it's mostly woods. And that, to me, is the way to protect your animal's gut, is to keep them on natural ground. But people that live in the city or live in towns that are not as clean, they need to be paying attention to what they expose their animals to, because that's how you protect them, is not giving them all these chemicals. But people put the chemicals all over them. Every single month, they get the flea and tick medication. That kills the microbiome. Those medications are not healthy for your animal. They are causing dysbiosis of the gut. If they're killing fleas and ticks, what are they doing to the 4,000 microbes that live in harmony? They sure aren't living there very comfortably with all those pesticides in their system, and the fact that the cat will lick itself and it's coming and absorbing through the skin. So it's everywhere. So every time you put something like that on your animal, you're poisoning it. So the more you poison it, the better chance it has of not having a good immune system. Between the food that we feed our pets and the topical medications that we give them, they're not a healthy bunch unless you can try to do things more organic, more natural, with herbs. And that's what I've tried to do for my dogs for 30 years and 7 generations. So that's the donor group that is part of Touch of Life Microbiome, which is my dogs. We have cats, 2 cats, but I don't really market the cats because I don't have more than 2 cats. And, you know, I can get some of it to people through their veterinarian, but I don't have as much. We have, you know, enough for the dogs and right now. And, but, you can use the dog on the cat, and I have done it and it seems fine. But there are people out there that are raising natural kittens. The Natural Rearers is a group that started many, many years ago of trying.
Well, maybe we can find some kitty donors within that group.
Right. And I thought about that because at this point, we need more cats as donors. But it's hard because I'm so strict about what my cats get exposed to, right? So if they're putting Febreze on the fabric because they don't want the house to smell, or they're doing other things in the house, spraying for cockroaches. I mean, I try to have everything organic and very little plastic in my house. The toys that they get are all natural toys and not something that has dyes and coloring and everything else if they chew on it. So it's a thought process that everything I do, I think, how is it going to affect their mouth flora? Because the mouth, my cats and dogs in 30 years have never had tartar, plaque, gingivitis, lost a tooth, not my cats or my dogs. And that's due to the biofilm in the mouth. There are 700 species of bacteria that live in harmony in your mouth, okay? And I'll tell you, one of my biggest pet peeves is when your cat or your dog goes for a dental, the standard of care is to put them on antibiotics. I have not used antibiotics on any dental since 1993. So that whole thing is such a causation of dysbiosis of the gut, and many people will trace their cat's GI problems from having the teeth cleaned. Because you're throwing this clindamycin into the body, it's disrupting the microbiome of the mouth, and it's disrupting the gut flora. First of all, if they have tartar and they're starting really young, from that point, they're dysbiotic because they're already getting something that they shouldn't get. Again, my cats have never had tartar, little maybe, I'll flick it off with my fingernail, but that's so rare that I would see it on my cats. And I've never taken one tooth out of any of my animals for loss of gingiva. My other cat lived to 20 and he had perfectly clean teeth when he passed.
So my little one, she just turned 2 and she just had her first dental cleaning last month. She, quote unquote, has dental disease. However, it is stage 1, grade 2.
If the cat has dental disease at 2 years of age, you have to get to a holistic vet and give them a fecal transplant and do stuff to help them rebalance their microbiome in their mouth. Because it all starts from the beginning. When I studied with Richard Pitcairn in homeopathy, he said if you start seeing the red line and the gingivitis in these young cats, they are already really sick. And so when I see that in a young cat, now, before I did fecal transplants, I was treating them with digestive enzymes and different things like that because I didn't have a tool as efficient as the fecal transplant. When you give a fecal transplant, it's picked up in the colon, into the bloodstream, and it goes to the whole body. It will help the heart. It will help the kidneys. It'll help the liver because there's microbes in the heart, in the liver, in the bladder, in the kidneys, and they're out of sorts when you put somebody on antibiotics. Where do you think the antibiotics go? They just go and they have a sore toe and it goes right to the sore toe? No, it disrupts everything.
I know in the commercial online world, it says that 80% of cats and dogs will show signs of periodontal disease and dental disease by the age of 2. Do you feel that that is normal and standard, or do you feel that all of these ones showing signs at that age have a disruption in the gut and the oral biofilm?
I think they have a disruption.
Okay.
Because my dogs and cats never have had any bacteria, when they drink water, their mouth, it's, the backwash comes off, right? And you get that film inside the bowl. So what I do is after 2 days of them drinking out of the bowl, I wipe with my hand and put it into glass jars, and our clients buy it, and they buy the water, and then they they take their bowl and they put boiling hot water to get rid of their not any chemicals that would be a residue that would kill the microbes, but use boiling water and scrub out their bowl. They put natural spring water and a teaspoon of our mixture into that and sort of set up a culture. So set them up. And then by setting them up to the thing and letting it grow, then when the cat drinks the water, it inoculates itself. But prior to them drinking it, I have people get ozonated olive oil and put that on their mouth to disrupt the biofilm. So we're doing like an oral microbial transplant via water.
Because I know my little one, since she's been on raw food solely, she does not drink from the water bowl.
Yeah, right. They don't drink that much. My cats don't drink that much either. My dogs don't drink that much because my food is made with a lot of water. And we use reverse osmosis at our well, which doesn't have fluoride and chlorine, and we have it alkalized in hydrogen. So my dogs get really clean water, but they don't drink that much. That's why I don't have a lot that we sell, because they don't drink a lot of water because they don't get dry food.
Could you put the oxygenated olive oil, could you put a little bit on your finger and rub it onto their teeth and gums? Is that?
Absolutely.
Okay.
Absolutely. And, using that on their mouth to help it. But if you want to reestablish the new oral microbial population, then you need to have some way of inoculating it. So many people will notice that if one animal in the house comes in and has bad teeth, it usually will transfer because they're drinking out of the same bowl, and you have one powerful microbial group that is infecting the other animals. I'll see all their dogs in the house have rotted teeth, right? So that's why I won't let my dogs drink out of anyone else's water bowl, because I don't want any other contaminants going in there. But I'm happy to share my dog's water bowl, but not have them share your dog's water bowl. But I just think it's so fascinating that these microbes that have been around, there's a chronological map of the evolution of the earth that I have 3 of them in my clinic. And it shows the evolution of the earth from all the billion years ago. And they have the earth's crust at what it looked like and how it changed. And then on the far right, they have all the different species of animals. And so the most current ones are your mammals, and then they have your amphibians and your plants. I was looking at the bottom, and in the bottom of that chart with all the animals was a little brown box. And the line went all the way to the surface to where we are now. And that was all the microbes. So they've been around way longer than any other thing around, and they have been the beginning of every species, every plant, and everything. So when we're trying to kill it off, we're killing ourselves, and we're trying to kill our species because they are running us. We have 10 times more microbes in the body than we do cells. So there are 10 times more of them than they are of us. So it's an important thing to protect.
I think my mind is blown slightly with the connection between the microbiome and fecal transplants and dental health.
No, it's fascinating to me. And I keep talking about it, and I took a dental class on extractions and different pieces, and I was so unimpressed with the dentist because he wouldn't even listen about the microbial population. He still was recommending clindamycin on every dental. And I was like, I haven't used antibiotics in 30 years for dentals. And I get the gums to heal right away, especially with Ozone. We flush the mouth with Ozone prior and after, and then we give the owner ozonated oil to put on the teeth, and the gums heal in in hours.
And can you explain to everybody what ozone therapy is?
So the term ozone has been around for over 150 years or 200 years now. But Nikola Tesla developed the first ozone generator back in the late 1890s. And it was used all during World War I to prevent wounds, and it prevented infections and stuff. And when they developed antibiotics in the 20s, they basically said, we have the magic bullet. We don't need this anymore. So they threw it out. condemned it as a toxic gas that has no medical use. And that's what the FDA talks about it. It's a toxic gas and has no medical use, even though there's probably 100,000 doctors around the world that use it. It's used a lot in biological dentistry because there's nothing that all the microbes are killed by it. So it kills good microbes too, but it then floods the body with oxygen. Whereas if you're doing an antibiotic, you have no idea what you're killing. You're just throwing an antibiotic, which can cause dysbiosis long term because it's taken systemically. It's not just put right on the tooth. If you Google microbial populations in the mouth of a dog, you can see that every section of the mouth is a whole different community of microbes. Next to the tooth is a whole different community that's on the tongue, that's under the tongue, that's on the roof of the mouth. So who thought of that, right? So if you put them on clindamycin, you're disrupting all the balance. Instead of doing that, using ozone to clean out the mouth and then repopulate it with a balanced microbial population is how I think dentistry should be done, instead of putting fluoride in there, which is toxic.
Yeah, that would be absolutely wonderful if that was mainstream.
Well, we got to talk about it and start to demand that. Why aren't we doing that? Let's think about the bigger picture here. When veterinarians say, well, we need our antibiotics. I need antibiotics when I need antibiotics, and you guys are causing it to be disruptive and not having anything that works anymore because everybody abused them.
Yeah, I think if there was more natural elements in the procedure of dental cleanings, I think it would ease a lot of people's hearts and concerns.
No, I agree. And I had a really old dog that had terrible teeth. And the owner was like, it's too dangerous for the dog to have a dental. And I said, I agree. So what I did is we had her put ozonated oil on the teeth and started doing the biofilm water. And when I saw the dog again, so much of it had already broken off. And sometimes what I'll do is just crack with a tartar cracker, just to crack a little bit so that it makes it more porous, so that the ozone can get in there and break it down and do it that way. So that's some of the things. So it's pretty cool.
We are recording this a week after the Los Angeles fires.
Mm-hmm.
How can we combat the effects of fire and smoke within our pet's microbiome?
Oh, gosh. I think the residues of this toxic stuff on the ground and in the air and in the grass that may grow back, it's still going to be there for a long time. And so much of it is really toxic stuff. So if I had to live there, what would I try to do is to mitigate it. First of all, you can't put a mask on your cat and have them breathe all day long with a mask on. They just don't tolerate that. For your pets that go outside, I would probably get them booties and then wipe them down on the outside of their coat so that any residue that has fallen down, especially now in the very acute stages of the fires, is to wipe off whatever toxic materials coming down off the sky. There's so much asbestos that were in these older homes that are still there, that were older pieces of property. And then all the plastic and petroleum stuff that comes from our computers and our, CD covers and our, whatever we have that's been held up in our houses is all toxic stuff. And then I would encourage people to do ozone at home, because that helps get rid of petroleum in your body, and do ozone sub-Q as a saline or rectal gas, or, giving them ozone water, try to help them somewhat to do that. And then I think in a few months or a month or two is to really seriously look at the microbial population and see, what we can do and try to populate it with an animal that is from a population that has not been damaged by this insult to the community and to the whole entire Southern California area.
And when we spoke earlier, you mentioned ozone therapy being used for burns. And so can you speak a little bit about that?
Yeah, oh, absolutely. Thank you for reminding me that. So because ozone floods the tissue with oxygen and brings down the infection and inflammation so gently, it's perfect for burns. In Brazil, when they were having huge fires there, they were treating the jaguars and the big cats by soaking their paws in ozone water and then bagging them in ozone gas. And so there's all these techniques, and, I'm writing a book with Dr. Jill Rubin, who's based in California. She's up in Orangevale, and she also sells ozone generators. And, pet owners can learn how to do this. They can educate themselves. They can do it at home. Veterinarians obviously can do a lot more because there's intravenous components to doing some of the other procedures. But to have, your animal washed with or wiped down with ozonated water would be how I would do it right now. If you had an ozone generator and can make ozone and water and then take a cloth and wipe the skin because it'll remove the petroleum and sort of clean the hair, is something that I would do too as well.
So how do we do that at home? What do we need?
There are several companies that are out there. O3 Vets is one of them, and then Regeno31 Vet, REGEN031 Vet is Dr. Rubin's company. And then another company is called Promo Life, and they're based in Arkansas, and they sell an ozone generator. They have lectures that you can go to, online ways of understanding. The simple things that you could do at home is doing ozonated oils or ozonated, things that you can apply topically. There's ozonated suppositories too that have been made by Promo Life, and O3 Vets has suppositories as well. And that can help too with the irritable bowel. It's so exciting to be part of the beginning of this, and I was really the one who embraced it in a big way and started to talk about it, lecturing at AVMA and lecturing at NAVC on ozone therapy, because I saw such a major change in the health of these animals that I needed to say something. I needed to talk about it, and it seems like it just flared up the veterinary board. You can't talk about it. You can't talk about it. It saved my horse's life. It saved lots of my clients' animals' lives, and I can't talk about it. It's very sad to me because I went to the World Congress of Ozone Therapy just this past May in 2024, and the one in 2012, we got blessed by Pope Francis at the Vatican for saving so many lives worldwide with ozone therapy. And then I get here and they attack you, right? And we were there just there recently, and the Congress they talk about antimicrobial resistance. Ozone has been working on that for 40 years, and everybody threw us under the bus. And now we don't have a tool for it, and ozone does work.
For those new to the concept of ozone, what is it specifically?
You take pure surgical oxygen. You put it through an ozone generator, which causes the O2 to become an O3. That is a very transient thing. It doesn't hold up. But in that O3 state, it's toxic to bacteria and fungi and viruses. Kills those things on contact, and then it turns around and floods the body with oxygen. So that cells of the body are rallying, the mitochondria are rallying about this extra oxygen being forced into the tissue. By doing that, you're stimulating the most active cells in your body are stem cells. So by stimulating those stem cells, you're increasing the circulation of good stuff in your body. So how I look at it when we do it rectally, at the crypts of the colon, at the bottom of the columnar cells in the colon are stem cells that create the cells that line the colon, but they're all in these very twisted, deep crevices. The oxygen ozone goes into that, stimulates those stem cells, so cleans them out, allows them to get rid of the surface that's all got things that are preventing the normal circulation in between the gut and the microbial population. And then you put new microbes in there. But the ozone sort of cleans the slate and allows the healthier stuff to start multiplying.
Beautiful. This sounds like magic to me.
It is magic. It is magic. I mean, I can give you a case of a dog that I think is magic. And I've lectured on this and published it in a peer-reviewed journal article. And it is magic. The dog's name was Titan. It was 2022. He got hit by a car. He was taken to the emergency, and he had a broken up fracture of his lumbar vertebrae, L7. And he had no pain, no motor, a little teeny bit of motor in the left leg, but the right leg was gone. Had no anal tone, no bladder tone, and was in terrible pain. Okay. They took an x-ray at the emergency clinic, and they said, he's a Rottweiler. You're going to have to carry him around. He won't have anal tone. He won't have bladder tone. You should euthanize him right away. It's not fair. So she's crying and hysterical, and she says, no, he's like my child. I can't do this. He's 14 months old. He's like the love of my life. I can't do that. So she takes him to the main campus here at the vet school. They do an MRI. The two surgeons come out and sit her down and say, dog's never going to have anal tone, never have bladder tone. This is cruel. You need to euthanize this dog. She says, no, please do the surgery. I love this dog. They said, well, at best, we're going to get the left leg to work and the right leg is going to be not so great. But he won't have anal tone or bladder tone. I can manage that. I'm a nursing student. So he ended up with an antibiotic-resistant urinary tract infection, which they had him on chloramphenicol. Now, chloramphenicol was used a lot for upper respiratory infections in cats back when I was in vet school, but it's been taken off the market because it causes serious health issues in humans and even death. So wear gloves. Don't touch this medication. So the dog presents to me 9.5 weeks after surgery. He comes in. He can walk 20 feet. He's vibrating in fear. He's shaking, so scared of everything. He can use his left leg. His right leg he drags, and he's dripping diarrhea with blood in it because he's ulcerated underneath his little tail, and it's bleeding, and he's got urine that smells like dead fish that's dripping from his bladder. He smears that all over my room, and she's like crying, like, what do we do? So I said, well, let's get him off everything that they've got him on. And then she tells me that their son, who is 3 years old, walked through the urine that had the chloramphenicol, ended up in the ER and showed me pictures of him head to toe body rash all over his body and was in an emergent state. So the vet school knew about it, and they said, well, then euthanize the dog because we have nothing else we could do, right? So we took him off everything. We flushed his bladder with ozone. We did ultraviolet blood therapy with a hemolumin, which is photobiomodulation. This is in the first visit. I did subcutaneous ozone over his whole back where the injury was and the surgery was. And I did what's called aquapuncture, which is B12 injections into the acupuncture points. And I've been doing acupuncture since 1975, okay? I've never, ever seen this happen. When I wanted to put the needle in, I felt like I had, instead of my needles usually slide down very simply. And what I felt like I was taking a Phillips head screwdriver and trying to screw it through 1.5 inches of beef jerky. It was like grinding it through this dense piece of tissue. And I did the acupuncture on him, did laser on his bladder, flushed the bladder, gave him rectal ozone, and started him on oral microbiome and some homeopathics for the trauma and the damage to the nerves in the back. Did that day 1, did that day 3. Day 4, she calls me and said he wagged his tail for the first time since the accident. So that release of the acupuncture with the fascia allowed the energy to come down to the meridians, and the dog was wagging its tail. Day 5, the dog comes back in for another treatment. I didn't do a fecal transplant because the dog was on a really strong antibiotic, and I figured I'll just be killing it off before I even do it. So I gave the fecal transplant on day 5. She calls me day 6. She says, we just walked 2 miles. He peed and pooped on his own normal stool and normal urine.
Wow.
So that is all from ozone and microbial populations repopulating and creating neurotransmitter precursors that allowed this dog to come back to itself. So that case, to me, is my 45 years of practice all in one case. And I think it's so important to have hope like that you can repopulate the immune system with a fecal transplant and use medical ozone instead of more antibiotics and more drugs and more anti-inflammatories and more autoimmune suppressors and cytokine inhibitors to make an animal whole again.
Thank you for sharing Titan's story. I know some, maybe even many, will see themselves in this story, and it's a ripple effect that will help others navigate their own health challenges with their pets. I know from a conventional point of view, it sounds like magic and a miracle, but it could and should really be mainstream.
Oh, absolutely. And I can't practice without ozone. I forgot how to practice without ozone. I don't want to go back to using the antibiotics. That's from the 1900s. I don't want to go back to that, right? So having a tool like laser and ozone and ultraviolet blood therapy are not hard to learn. These are not hard to learn. Acupuncture, yes, that's studying. Homeopathy, yes, that's studying. But these simple ways that people can increase their success of the tissue that's there like Ozone, and of course the fecal transplants and the microbiome restorative therapy, which I think is a better term to use. And that's why I'm not always using FMT, because I want more than FMT. FMT is just the beginning.
Yes, it's amazing how many things are out there to help our pets and ourselves. It's just getting the word out. And that's why we do this podcast. And so in closing, are there any final thoughts you'd like to share?
I think it's important for pet parents to understand that there's options. And if you're only going to a conventional veterinarian and they're not willing to look outside their box, then find another veterinarian. And it's hard to find veterinarians. Veterinarians are not wanting to practice anymore. They're burnt out. They say now a veterinarian will have an 8-year career. You know, when you have veterinarians that are just burnt out, I think that if they had these choices and options, their compassion fatigue would drop. They would have another way to help an animal and be excited that they could try to heal the animal versus try another drug.
I agree. And I think the success rates would increase and in turn improve mental health.
I agree. I mean, it's so traumatizing. I mean, when I lose a patient, I tear my head apart trying to think of what else could I have done. When you have all these other options, you are at least trying something else. And I don't know every option. I'm always picking up another rock looking for something else I could do for an animal. If I can filter through all the things that I've seen and try to help them, and if I can't help them, find somebody who can help them. But I think it's just the standard of care, which is to me a very low standard. If you tell somebody you can't think of anything else you can do for the cat, it's time to euthanize the cat, and you don't know acupuncture, and you don't know herbs, and you don't know ozone, and you don't know fecal transplant, and you don't know homeopathy, and you don't know chiropractic, and you don't know any of that, to me, that is malpractice. And I'll say it. To not have that choice when it's covered by many of the insurance companies is, to me, denying care to the pet. Period. It's really hard sometimes to get others to listen to this, and it's been a real difficult travel for myself in that most standard of care does not include these alternative ways of doing things. And my clients really appreciate it, and they're grateful that they have another choice than to keep doing more diagnostics and ultrasounds and biopsies and more drugs and more medication. And sadly, in my practice, I've had many animals that have come to me after the owners have spent $20,000 and $30,000 with conventional diagnostics, and they come and we're able to do something holistic and solve their problem in days. And that, to me, is very rewarding. But my clinic is called MASH in Hopkinton. And right now, I'm not practicing because the veterinary board cannot stand that I do something different. And they've been trying to stop me for over 20 years because I stood up to them and I stood up to Tufts University over my horse who had cancer, and they said he'd be dead in 2 days. And with ozone therapy, he lived another 2.5 years, and he lived 8.5 years with a cancer that in conventional medicine would have been a year. And he was still jumping in horse shows till a few weeks before he passed. So it's important for me to share the experiences I've had with my clients' animals and my own personal animals with as many people so that they have the knowledge to speak up and understand more so they can help their pets.
Is your practice still open and other veterinarians are practicing under you?
Mm-hmm.
Okay.
Yeah, so I have an associate that's working there, but she cannot do as many hours as I would love her to do, and we're looking for another vet. And if anyone there is listening and you want to be a cutting-edge integrative veterinarian, we have room for you, and we'd love to have others join us to try to give more options to pet owners.
I'm happy your practice is still going strong, and that's an amazing opportunity for someone. If I were a vet, I'd be packing my bags for Massachusetts. And so for more information on Dr. Margo Roman, visit mashvet.com. And to learn more about her fecal and microbiome restorative products, visit mbrt.life. Thank you so much for fighting the big fight, Margo. My hope is these holistic healing modalities become the go-to in our vet offices.
Well, I think there'll hopefully be a change, in the way that medical ideas are accepted. If you see something, you say something, and that's what I have been taught. If you see a reaction in a certain way and you repeat it, you see that action again, you may not have clinical trials and 40 animals to document. And even if I did, as an integrative doctor, they will say, you need 60 animals. We're not going to believe it unless you have 80 animals. And so whatever it is, if it's not a pharmaceutical that is being funded by the funding comes from the pharmaceutical companies that fund the veterinary schools and the law schools and the medical schools and the dental schools and the veterinary boards. And so if you don't have that funding, you're an outcast and you can't speak out. And I feel it's not fair, because if there are very natural ways to help an animal, I think we need to speak up about it and talk about it. And it should be in the spectrum of care. And that's a new term that the AVMA is supporting, that it's a whole spectrum of care. And so integrative medicine is part of that spectrum of care, and it needs to be part of the spectrum of care.
I agree. Margo, thank you so much for joining us and for all you're doing for us and our pets. You're a very, very special human.
Oh, you're welcome, Angela. It was great talking to you, and hopefully your success with the podcast will be great, and you can give information to people and empower them to be smarter and ask questions, read. And there's been a lot of pet summits that people can learn about GI issues and skin issues and detoxing, and those things are also very interesting to listen to.
Absolutely. Those summits are amazing, full of knowledge, and I encourage everyone to attend. I've learned so much from those. Thank you so much again, Margo.
Take care.
Thank you for listening to the Holistic Feline and Friends podcast. It is created, hosted, produced, and released with love, and my hope is you learn something along the way. When we know better, we do better. Please share your knowledge and our podcast with others. For more educational content, follow us on your favorite podcast platform, as well as Instagram at The Holistic Feline and online at theholisticfeline.com, where you will also find our blog that includes corresponding posts for each podcast episode with links to all the good stuff. Thank you again. We'll see you in the next episode.
The Holistic Feline and Friends podcast, website, blog, and socials are for informational and educational purposes only. All information, suggestions, recommendations, or comments, whether by written, verbal, audio, or otherwise, either direct, indirect, or association, is not a substitute for professional veterinary care. Please provide your pets with a minimum annual professional veterinary visit, and more often when health concerns arise. The Holistic Feline, Angela Warwick, and all guests and associates are speaking from experience and education. Please continue your research and form your own opinion. This is in no way a means to diagnose.